Hey there and welcome. So, you're looking into photodynamic therapy, or maybe you've already got an appointment. Well, you are in exactly the right place. We're going to break down this entire process for you, step by step, so you can walk in feeling confident and knowing exactly what to expect. All right, here's our game plan. First, we'll get into what PDT actually is. Then, we'll cover everything you need to do to get ready for your appointment. After that, we'll walk through the treatment day itself. And finally, we'll talk about the most important part, your recovery. So first things first, what in the world is photodynamic therapy? Let's peel back the layers and look at the science of how this actually works. You've probably heard the name thrown around, but what does it really mean for your skin? What is this thing actually doing? Okay, in the simplest terms, think of PDT as a smart balm for your skin. It's a non-invasive treatment that uses a special solution and a specific light to seek out and destroy abnormal cells. We're talking things like precancerous spots or sun damage, all while leaving your healthy skin alone. The real magic here is in this two-step combo. First, a light sensitizing solution goes on your skin, and those damaged, faster-growing cells just soak it right up. Then, a special light gets switched on, and it activates that solution, telling it to destroy only the cells that absorbed it. It's incredibly precise. Okay, so now we know how it works. Let's get practical. Getting yourself properly prepared is absolutely key for a great result, so let's talk about what you need to do before you even walk through the clinic door. Believe it or not, your prep work actually starts about 2 weeks out. You gotta avoid all sun exposure, tanning beds, even fake tanners. Then, 2 days before, if you're prone to cold sores, you'll start your preventative meds. And on the day of your appointment, it's super simple. Just show up with a clean face. No makeup, no lotions, nothing. And you'll want to pack a little go bag for the day. You're going to be really sensitive to light on the ride home, so sun protection is a must. I'm talking a big hat, sunglasses, maybe even an umbrella. And, there's a bit of a waiting period at the office, so definitely bring a book or something to keep you busy. And here's a pro tip. Make sure you block off a good chunk of time. The whole appointment from start to finish can take anywhere from 1 to 3 hours. You definitely don't want to be in a rush. All right, the big day is here. You've done your prep, you've arrived at the office. So what happens now? Let's walk through the procedure step by step so there are no surprises. Now, your provider is going to use either a blue light or a red light. The blue light goes with a solution called Levulin, and you're under the light for about 20 minutes. The red light uses a different solution called Ameluz, and it's a bit quicker, around 15 minutes. But honestly, besides that, the process is pretty much the same. And here's that process. It's 4 simple steps. First, they'll clean your skin really well. Second, they'll apply the solution. Third, you'll hang out for a bit while that solution soaks in. That's the incubation part. And finally, you get placed under the light to get things started. It's all very controlled and straightforward. So let's talk about the big question, what does it feel like? Most people say it feels like a pretty intense sunburn. Some heat, maybe some stinging or burning. But the good news is your provider is right there, and they usually have fans and other things to help keep you comfortable. Okay, the light part is over. Now we're heading into the most critical phase of this whole thing, your recovery. Knowing what's coming and how to take care of your skin is going to make all the difference. All right, I want you to burn this number into your brain. 48 hours. The first 48 hours after your treatment are, without a doubt, the most important period for your entire recovery. Your skin is incredibly sensitive to light during this time. For those first 2 days, you need to think like a sun safety ninja. Your main goal is just to stay out of direct sunlight. If you absolutely have to go outside, you've got to layer up with protection, a high SPF sunscreen, protective clothes, and that wide-brimmed hat we talked about. So what's your skin gonna do? Well, day 1, it's gonna look and feel like a sunburn. That's totally normal. Then around day 3 or 4, you'll probably start to peel. Whatever you do, do not pick at it. By the end of the week, the redness starts to fade, and you'll see that new, healthy skin coming through. A little bit of crusting is also perfectly normal. And if you're feeling a little uncomfortable at home, you've got options. Cool ice packs are your best friend for any swelling. Here's a cool little trick. A mix of white vinegar and water in a spray bottle can feel amazing on any stinging. And of course, Tylenol or ibuprofen are totally fine if you need them. For the next 2 weeks, your skincare routine has one simple rule. Be gentle. We're talking super mild cleansers and thick, simple moisturizers like Cetaphil or Aquaphor. This is not the time for anything harsh, so just put those scrubs, toners, and retinoids away for a little while.
And of course, the question that's on everybody's mind, when can I finally put makeup on again?
And the answer is actually really simple. Your skin will tell you. Once all that peeling and crusting is done and your skin just feels comfortable and back to normal, you're good to go.
So, we've walked through this entire journey together, from the science all the way to recovery. What's the one big thing you should take away from all of this?
It's this. Photodynamic therapy isn't just a single treatment. It's a whole process. And by knowing these steps and following them, you're not just a patient. You're an active partner in this, taking full control of your skin's health.